Oh yeah, good afternoon. Um, so this is a new year, and just as I've promised, this video right now is form of an online tutorial, or should I say, guide to be able to help my junior ones, my junior colleagues, those that are still in nursing school, on strategic way on how to go about their reading and the study at school. So this particular video is for those in 200 level, or should I say year 2 in nursing school. So what I will be discussing today will be about different topics that will be treated in year 2 in 200 level, starting from the fundamentals of nursing down to jurisprudence, cell pathology, etc. as God help us in this video. So to start with, I'll be starting with fundamentals of nursing. I finished from Delta State University, so the way it worked for me when I was still in school was that in our first semester we treated just one nursing course. We call it NSC, and then it was NSC 201. So it's in the second semester that we now start treating, I think, about four nursing courses, NSC 211, 212, like that. So but me, I'm not going to be working that way. I will just carry the fundamentals of nursing as one, jurisprudence as one, cell pathology as one, just like that. So let's start from fundamentals of nursing. That's like the major thing in 200 level. You must know the base, you must know the foundation, you must know what nursing is all about. It's not even in 100 level that you will be taught what nursing is really all about. It's when you enter 200 level. So you should be prepared that, okay, in 200 level, this is what I'm going to meet. So fundamentals of nursing, of course, the first thing you should be ready to know is what nursing is all about. The definition of nursing, by different persons, by different persons. So we have 90 Gale definition of nursing, we have Pell Plan definition of nursing. So as a student, you're expected to go through your books and know these definitions because they are literally different. They are literally different. You want to talk about peaceful death, you want to talk about environment. So you really need to know each definition and who are the people that really spoke about this definition. What's the definition of nursing according to Nightingale? What's the definition of nursing according to Pepper? I don't know if you're getting it now. So you really need to know each definition according to the person who really brought about the definition. So after knowing the definition of nursing, we are also expected to know how am I going to put it now? The concept of nursing. The concept of nursing. I think nursing is divided into four concepts. So I think man, health, environment, and nursing itself. So you really need to know that. And then, still talking about nursing, you need to know about nursing theories. There are different people that talk about nursing, and there are different theories. We have Orem's theory, we have Nightingale theory, we have environmental theory of nursing by Nightingale. We have Orem's theory of self-care. So you really need to know these different theories because if you know this theory, it's going to work for you in jurisprudence. In jurisprudence, I'm also going to talk about theories. So knowing this foundation now while you're studying nursing will really help you as you go further. So in all, once we talking about this fundamentals of nursing is when you talk about the history of nursing. Yes, you're expected to know how nursing came about, how nursing came about, how nursing came about, and the major role of Nightingale in the study of nursing. Of course, we know that Nightingale is the mother of nursing. So, okay, what brought about this woman Nightingale that we all talk about now? What was her role? She really played a role. When in fact, you need to know an history about Nightingale herself. An issue about Nightingale herself. Nightingale was the mother of nursing. When was Nightingale born? When did she die? What were the things she really did when she was still alive? So you really need to know that. I also need to know the history of nursing starting from the traditional level. I think at traditional level, nursing was just seen as care. Whereby you just help those that are not even prevention, those that are just sick. Let me put it that way. So nursing starts roots from there, to from being a vocation, it grew like that to now become what we study in nursing. And of course, that's where we get the professionalism in nursing. So when we talk about nursing, the fundamental of nursing, we're talking about definition of nursing by different people, by different persons. I talk about Eager, talk about Pepper, talk about Nightingale. So you really need to know these people. Definition of nursing, concept of nursing. I spoke about history of nursing. Is this particular history of nursing that lead to professionalism in nursing? And that part is very important. I mean, they can actually tell you that discuss professionalism in nursing, 10 marks. That's to tell you how important that professionalism in nursing is, how we grew from being just a vocation, of course, nursing mothers. So they feel nursing is just you being able to take care of somebody, you become automatically a nurse. No, but nursing has risen from that mentality, from that mindset. There's been a mindset shift, and there's been a mentality shift, and that mentality shift is what leads to professionalism in nursing, that now make us not to see nursing as just a vocation or how am I going to put this, like nursing has now become what you can literally go to school and study for a good 5 years and bag a certificate in it and earn good salary in it. So there are things that actually sum this up to actually make nursing that great profession. So you really need to go and study that. Talking about autonomy, talking about body of institution, talking about theory. So my assignment to you is go study professionalism in nursing. And peradventure, if I still have time, I might still go back and talk about professionalism on its own. So yeah, fundamentals of nursing. I said you're going to learn about professionalism in nursing as well. Then you're also going to learn about different specialization that we have in nursing. Nursing is not just general nursing anymore. No, we have nursing, we have peri-op nursing, we have ICU nursing, we have critical nursing, and put it that way. We have pediatric nursing, we have NICU, that's neonatal intensive care unit, those people that treat and that take care of patients in the special care unit. So that's NICU. We have mental health nurse, we have anesthetic nurse, we have orthopedic nurse. So these are nursing specialization, which you should also know. We have nursing researcher, we have nursing informatics. So nursing has grown big. It's no more just general nursing. We have people that specialize in nursing fully in different areas, in different specializations. So you are expected to know that was also. And then you need to know the roles. Yeah, the role of a nurse. I think we have about 10 role of a nurse. Nurse as a carer, to take care, to educate, to teach, to communicate, to be a patient advocate. These are roles. These are what is expected of a nurse to do. So literally you need to know this also as a student. You need to know what is the role of a nurse, what is the role. There are about 10. A manager, an advocate, there are many. Just go read them up. Then other thing you need to learn, to know why I'm doing all this is that so that even when lecturers have not come to class to tell you these things, these will be things that on your leisure time you can usually go and read and study, so that when lecturer is not teaching later on, like, oh wow, wonderful. So it will help. These are the strategic way we read, and we come out to be excellent. And that thing which is very important is the responsibility of a nurse. Yes, there is a striking difference between the responsibility of a nurse and the role of a nurse. So the role of a nurse is when we talk about manager, advocate, all these things. Then the responsibility of a nurse, there are 4. So you need to know the differences. Role, there are about 10 or so. But responsibility of a nurse, there are just 4. And what are the 4 responsibilities of a nurse? Is number 1, to promote health. Number 2 is to prevent illness. Then number 3 is to restore health. And number 4 is to alleviate suffering. So these 4 responsibilities of the nurse, you really need to know them. I remember when I wrote my internship exam at UCH, University College Hospital Ibadan, this question was actually one of my questions, responsibility of a nurse. And thank God for Delcy, because he taught us, So I was able to pass that question. So this is me training back for you too. I should be able to understand the difference between responsibility and role of the nurse, because let me surprise you, there are people that were actually putting advocate, manager. No, those are not responsibility, those are roles. But when we talk about responsibility, I'll come again. Responsibility of a nurse is to promote health, talk about health promotion, to prevent illness, talk about illness prevention, to restore health, and to alleviate suffering. So that's literally what you need to know about nursing part. Because in the fundamentals of nursing, you need to discuss nursing on its own. So then we now go about foundation of nursing. Foundation of nursing. This is when you talk about vital signs. Vital signs. So it's more or less like when your teacher finished teaching you nursing, everything you need to know about nursing. Then the next topic after that will be vital signs, because that's one thing that is very much important. So vital signs of giving a baseline data about your patient. And then when you talk about temperature, you talk about pulse, you talk about your respiration, you talk about your blood pressure, and you talk about pain. Yes, pain is the fifth vital sign now. So you really need to go read the vital sign as well. If I have the time, I will do a video again for vital signs on its own, talking about temperature, abnormality you can have in a patient's temperature, which can cause to, which is either it go higher or it go lower. When it go lower, you call it hypothermia. Then when it go higher, you call it hyperthermia. And that hyperthermia can result to fever. You say, my body is hot, fever. So you really need to know what grade of temperature, like what would be your thermometer reading. Of course, thermometer is an instrument used in checking a patient temperature. So what will be that grade? What will be the result of that thermometer? That thermometer reading that will make you to know, okay, this person is having fever and this person is normal. So those are the things you really need to go learn. And talking about vital signs, you need to go and learn about patient temperature. That's number one. They call it TPR, BP, then pain. T for temperature, P for blood pressure, R for respiration, BP, that's blood pressure, then pain is the fifth vital sign. So that's vital signs on its own. But that does not end it all, because that temperature alone, if you start reading that temperature alone, is about 2 or 3 pages on. If I start doing a lecture right now on it, because you need to tell me the normal range of the temperature. What's the normal range? Let me just give you now. The normal range is 36.5 to 37.2. So anything lower than 36.5 is hypothermia. Anything greater than 37.2 is already indicating that, okay, this patient is what? Is having a deviation in his or her body temperature. So now we still have different kind of fever. We have pyrexia. That's, I don't want to go much because of time. I just want to be able to like summarize what to expect in NSC 201 or 201 per se, talking about fundamentals of nursing in this video. So probably when I have time again, then I will be able to take each particular or peculiar topics, then treat them on their own. But you can actually comment on the YouTube, yeah, on the channel, and whatsoever you want me to discuss in details. So I will from there pick up the topics and talk on them. So pulse as well, you need to be able to know the type of pulse that we have, the characteristics of pulse. Some are bounding, some are not bounding, some are regular, some are irregular. So you really need to know these things. And talking about respiration, we have characteristics of respiration too. We have different kind of talking about pulse. We have pulse that are higher than normal, that are lower than normal. We call them bradycardia, tachycardia. I don't know if you are getting. So those are things you really need to know, because they point to us that, okay, there is a deviation in the normal functioning of this patient, there is a deviation in the normal functioning of this person. So that's why vital sign is very important. Respiration also, we have those that are higher than normal and lower than normal. You need to know the normal range so that you'll be able to dictate, okay, this thing is going higher than normal and this thing is going lower than normal. We have what they call tachypneic. Tachypneic means this respiration is higher than normal, and we have bradypneic. Is saying that okay, it's lower than normal. Then talk about blood pressure as well. Blood pressure. Talk about hypertension is when you check somebody's blood pressure, you're able to know, okay, this person is having an elevated blood pressure, which is hypertension, and this person is having low blood pressure, which is hypertension. But of course, before you be able to say that, you must be able to know the normal. And talk about pain. Pain is on a scale of 0 to 10. You should be able to know when this person is having a pain, a moderate pain, a severe pain, a low pain. So that's that about vital signs. You really need to go. So my assignment for you is that go read on vital signs, know the normal, know the abnormal, and then comment on YouTube. Comment on this channel. Still talking about foundations of nursing. We talk about communication, different type of communication, steps in communication like that. So you can still study on communication. Then another thing is nursing process. Yeah, that's very important. Nursing process. Nursing process is when how will I put it now? Yeah, nursing process is a tool in managing care. Is a tool in giving individualized care to a patient. But before I go there, let's talk about physical examination. Physical examination is another one major thing you need to study when talking about foundation of nursing. I've spoken about nursing on its own. Not I'm nursing a baby. What nursing entails, the definition, the theories, blah 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 like that. Then after all, I went to vital science. Then after all, I went to communication. So the number 4 will be physical examination. Yeah, because that part is very important. Physical examination is when you examine someone or a patient or a client from head to toe. From head to toe. Starting from the head, the hair, the ear, the eyes, the nose, the mouth, the extremities, upper extremities, the abdomen, yes, the spine, that's the back. Talk about the lower extremities, yes. So you need to examine this patient from up to down, from head to toe. Be able to know if there is any abnormality. Is this person having 5 fingers, or their own fingers is 6, or is even 4, or is even webbed together? So this is the essence of physical examination. Another assignment, go and study physical examination. I told you that why I'm doing all these things, for you to know what to read, so that you can go back to your secret place and go and study. Yes, go and study to show yourself approved. You have to read. Don't wait for a lecturer to come and give you scheme of work. Don't wait for a lecturer to come and tell you what to do. Me, I'm telling you what to read now, because take it or you leave it. These are fundamentals. You really need to know them. So that's physical examination. Physical examination, it helps you to be able to assess your patient from head to toe, to be able to know what's wrong with the patient. And physical examination also have their own steps. There's a place there are 4, I guess: inspection, palpation, percussion, and auscultation. Yes, IPPA. We call it IPPA. You have to inspect the patient from head to toe without touching. Then palpation, you have to touch. Percuss is for sounds, so you hear the sound, the vowel sound, the long sound, the breath sound, all those things. Then auscultation is when you want to just check the heart rate and co. So you really need to learn that. You really need to know that physical examination. And then I can now go back to the part of the nursing process. So talking about nursing process, the nursing process is a tool to manage your patient. Now I have to go back to physical examination, because the steps of nursing process, they are into 6 ADOPI. I'm giving us mnemonic so that we can usually understand ADOPI. A for assessment, D for diagnosis, O for objectives, or should I say yes, objectives, then P for planning, I for implementation, then E for evaluation. So assessment is when you assess your patient from head to toe. So that's why you really need that physical examination. That's why I had to go back first to that physical examination. Physical examination in the sense that you have to assess your patient from head to toe. Then under assessment is also history taking. This part is very important too. History taking. They are going to teach us. History taking is also part of what to learn. Yeah. So talking about history taking is also part of your assessment. So this will still make me to say, okay, after that physical examination, you need to learn history taking even before nursing process starts. History taking is when your patients will come to you and they'll be like, patient, what's wrong with you? Don't share anything they worry you. And they'll be able to tell you, okay, I dey feel pain, something they happened to me, I no feel sleep. So that's taking history. And as a nurse, it's fundamental that you really know how to do that. So should I say they will teach us in school? But then before they will teach us in school, you should be able to have an idea too of what it's talking about. History taking is receiving or taking history, collecting information from your patient. It's subjective and objective. Subjective is the one that you are collecting directly from your patient, just where the patient is saying it. Then objective is what the nurse is saying this patient is having. So a patient coming to me and saying, nurse, I no fit sleep. Are you getting it? Or nurse, my belly dey pain me. That's a subjective history. Then me now saying, my patient says he couldn't sleep. My patient seems to have insomnia. That insomnia that I just said is a nursing word. So it's what I deducted to happen to that patient. So that particular history is what they call objective, what you can literally observe or see from that patient as a nurse. That's an objective history. But what the patient is saying by himself is a subjective history. Is as the patient is saying it is subjected to just what the patient is saying, not what the nurses himself is saying. So that's the difference between a subjective and an objective history. And talking about history, you also need to know the steps. You also need to know the steps. Talking about the chief complaint, the past medical history, the present medical history, the family and social history. Okay, I think I have so many things to discuss on their own, because if I say I should start doing this 1 hour, we are still here. So I promise that I will be talking about history taking on a video on its own, then vital signs on a video on its own, the nursing process, nursing care plan will be what I will do on its own. So nursing process, I said assessment, diagnosis, they call it outcome identification. Outcome identification, more like we are stating out objectives. So that's why I said objective before. Outcome identification, then we talk about planning, talk about implementation and evaluation. That's ADOPA. That's what nursing process is all about. Those you use those systems to be able to manage your patient by assessing your patient. So what you assess your patient from is what will now give you a particular diagnosis of what is happening to that patient. Let's assume patient that says she's having pain, or should I say, or patient that is saying, my body dey hot, I don't know wetin dey happen. And then you as a nurse, you check the temperature. I say that temperature is high, so that will give you a diagnosis. Okay, this person is having an issue with temperature. Is it hypothermia? Is it hyperthermia? So if it's high, of course hyperthermia. So that hyperthermia alone, it's a diagnosis. Hyperthermia related to what? Evidence by what? So that's that. Then diagnosis, that's what I just finished saying. Then outcome identification. So what's your objective? What's your outcome identification? Okay, this person temperature will come back to normal. That's what you want. That's an outcome identification. That's an objective that you want. Then planning. So you plan as to, okay, what should I do? How can I get this patient temperature come back to normal. Then implementation is you performing the action itself. Okay, I will tap a sponge. Okay, I will expose the patient. Okay, I will on the fan, blah 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 like that. Then evaluation is okay, you evaluating again if what you've implemented actually went out well or not. So then you are now going to like carry your thermometer again and check the temperature again. And if it's normal, of course, meaning you've achieved your goal, and that's a good evaluation. So that's for nursing process. I think I will talk about diagnosis later, because that's where we really tend to have issue getting the diagnosis of what is happening to the patient. But trust me, from the assessment you can get a true diagnosis of what is happening to your patient, and the earlier the better, because when I'm doing my internship right now at 2CH, we use nursing process and nursing care plan to take care of our patients. So as a nurse, we really need to know it, so you don't go for your hand for outside, understand that kind of thing. So what again? Documentation is also one thing you really need to know. As 200 level nurse. Documentation. What are the characteristics of a good documentation? What are the steps to have a good documentation? So you can go check on that later. Then what again? I think personal protective equipment. Yes, PPE. As a 200 level nurse, you need to know. Okay, we call it asepsis technique. Aseptic technique. What we do, or should I say infection control? Yes, let me put it that way. Infection control. That's the topic. So these are literally what we do to prevent infection in the hospital, or in our place of work. So they call it asepsis. As we talk about sterile technique, we talk about universal precaution, we talk about your personal and protective equipment. So personal and protective equipment, what we put on as a nurse to actually protect us from being infected or from infecting our patients. Talk about gloves, talk about gowns, talk about face mask, talk about face shield, talk about boots, all those things. So that those are personal protective equipment, PPEs. So that's literally it. Then universal precaution, what are the things to do? Talking about sewage disposal, talking about discarding our sharps, they are under infection control. So I think that's really all. Let me check. Talk about Maslow hierarchy of needs. I'm just when I'm remembering what I was taught in 2011, I'm just bringing them down. Maslow hierarchy of needs. You can still go and check that up. Talk about caring for your patient, oral care, or you call it oral toileting. That's like hygiene, bed baths. So bed bath, care of the hair, care of the eyes, care of the ears, care of the skin. So just like that. And that's it. That's it. Yeah. So I will just end it up with likely practical questions talking about OSCE that you should expect as a 200 level student. Of course, starting from what I just finished talking about, practical. You need to be able to know how to check the vitals, how to check blood pressure especially. You need to know it, because they might, and also question can just drop. Okay, for this Mr. Chase, check the blood pressure. Stating the procedure. You state the procedure, how you check it, blah 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 like that. Then vitals, yes. Perform a physical examination for this patient from head to toe. Yes. And also care, yes. Perform an oral care for this patient. A bed bath, yes, for this patient. And also there's something they call bed making. You need to learn how to make a bed too. So yes, I can also tell you how to don a glove, how to wear it and how to remove it. We need to be able to talking about PPE and steps in wearing a PPE. What should you wear first? Is it your glove that you should wear first, or your gown, or your face shield, or your face mask? What are you expected to wear first? So you really need to go and know that as well. Then yeah, I think that's really it. Talk about OSCE, you still have to do it education, still have to know your instruments and be able to identify them. So that's actually it. I promise to stop this video at 30 minutes and it's past 30 minutes. So yeah, thank you for staying tuned with us. So make your comment, and whatever it is that you don't understand, still let me know. And yeah, that's for 200 level. 300 level video will be posted next.